Hello everyone. This year on the 2nd of May, we are celebrating World Asthma Day. The theme for World Asthma Day is Asthma, Care for All. Now what is asthma? Asthma is an inflammatory disorder of the airways. I am Dr. Sushmita and I am a consultant in the Department of Pulmonary Medicine, Apollo Hospital, Guwahati. What happens in asthma is the airways, the muscles around the airways, they become hypertrophied or enlarged, as a result of which the lungs cannot expand. Secondly, there is an inflammation around the airways, as a result of which there is a decrease in the capacity of the lungs, and in the long term there is a lasting damage to the lungs. Thirdly, most of the asthmatics, they are highly sensitive to certain irritants like perfume, smoke, dust, pollens, etc., and to certain food items as well. So these asthmatics, they are most often associated with allergy. Coming to the symptoms of asthma, the most common symptoms are wheezing, which is a sound which comes up from the chest tightness, there is a chronic cough, and there is rapid shallow breathing. Most often, the symptoms of asthma are seen more often in children than in adults. In children, we have to observe that a child who is suspected to have asthma, if he or she has a rapid shallow breathing, if he or she has to take pauses in between the plays as compared to his peers, in those circumstances we have to assume that that person has got asthma and he or she has to be taken to a doctor. Now coming to the treatment of asthma, it is very, very important. We have short-term and we have long-term treatments. The long-term treatment is mostly to keep the asthma at bay. Now, these include the inhaled steroids. Now, most patients who come to us, they usually have a doubt that, ma'am, do we use steroids? Is it going to harm us in the long term? Then we have to explain to them that inhaled steroids is very, very safe. Only the technique of inhaler needs to be explained to the patient, and it should be made sure that they use the inhalers in the correct way. Secondly, after each use of inhalers, the patient should be advised to rinse his mouth or gargle, because the deposits of the inhalers, they usually get deposited in the posterior wall of the pharynx, as a result of which this could lead to fungal infections and also to hoarseness of voice. Thirdly, yearly vaccinations are very, very important. So we should give influenza vaccines to each and every patient who is suffering from asthma. Thank you so much.